what we face long term, the biggest problem we have is that Medicare and Medicaid healthcare costs are skyrocketing, and at the same time as the population is getting older, which means we're using more healthcare. You combine those two things, and if we aren't careful, healthcare will consume so much of our budget that ultimately we won't be able to do anything else. We won't be able to provide financial assistance to students. We won't be able to help build green energy. We won't be able to help industries that get into trouble. We won't have a national park system. We won't be able to do what we're supposed to do on our veterans. Everything else will be pushed aside because of Medicare and Medicaid. That's the problem that we really confront. That's why I've said we've got to have health reform this year to drive down costs and make health care affordable for American families, businesses, and for our government. So when you see those of you who are watching certain news channels that in which I'm not very popular, and you see folks waving tea bags around, let me just remind them that I am happy to have a serious conversation about how we are going to cut our health care costs down over the long term, how we're going to stabilize Social Security. Claire and I are working diligently to do basically a thorough audit of federal spending. But let's not play games and pretend that the reason is because of the Recovery Act, because that's just a fraction of the overall problem that we've got. We are going to have to tighten our belts, but we're going to have to do it in an intelligent way. And we got to make sure that the people who are helped are working American families, and we're not suddenly saying that the way to do this is to eliminate programs that help ordinary people and give more tax cuts to the wealthy. We tried that formula for 8 years. It did not work, and I don't intend to go back to it. All right. It's a young lady's turn. It's your turn. No, I'm going to call on her. I might call on you later, though. All right. Go ahead.
My name's Mary Wallace. I'm a licensed acupuncturist and licensed massage therapist in Florissant. And so
I could use one right now. My back's stiff. I've been working hard.
Oh, I'll be happy to help you. And this kind of fits into what you were just talking about as far as health care. I'm wondering, as a practitioner of Oriental medicine, knowing that the National Institutes of Health and the World Health Organization has discovered through their studies that alternative medicine often is more cost-effective and very effective. How will alternative medicine fit in your new health care program?
Well, look, my attitude is that we should do what works. So I think it is pretty well documented through scientific studies that acupuncture, for example, can be very helpful in relieving certain things like migraines and other ailments, or at least as effective as more intrusive interventions. I will let the science guide me. We've just swore in an outstanding new Secretary of Health and Human Services, Kathleen Sebelius, former governor of Kansas. It's good to see that a Jayhawk got applause on this side of the border here. But she's going to do an outstanding job, and my charge to her is, as we're going through healthcare reform, let's find out what works. I think one basic principle that we know is that the more we do on the prevention side, the more we can obtain serious savings down the road. So giving children early checkups, making sure that they get immunized, making sure that they are diagnosed if they've got eyesight problems, making sure that they're taught proper nutrition to avoid a life of obesity. Those are all issues that we have some control over, and if we're making those investments, we will save huge amounts of money in the long term. Unfortunately, the hardest thing to do in politics, and certainly in healthcare reform, has been to get policymakers to make investments early that will have long-term payoffs. Because people, their attitude is, well, I'll be out of office by the time that kid grows up, and the fact that they're healthy, that doesn't help me. And in the private sector insurance system, oftentimes insurers make the same calculation. Their attitude is, well, people change jobs enough for us to pay for the preventive medicine now when the problem may not crop up for another 20 years and they'll be long out of our system, so we don't want to reimburse it because it'll make things more costly. That's the logic of our healthcare system that we're going to have to change. The recovery package put a huge amount in prevention. We are, in our budget, calling for significant increases in prevention. And my hope is that working in a bipartisan fashion, we are going to be able to get a health care reform bill on my desk before the end of the year that will start seeing in the kinds of investments that will make everybody healthier. All right? Okay.